Hello everyone, I'm Dr. Nicholas Petruzzi. I'm the medical director of the AMI Vascular Institute. At the AMI Vascular Institute, just to give you a quick overview of what we do, we treat everything from arterial disease, peripheral arterial disease, non-healing wounds, to vein problems, vein disease like varicose veins or vein blockages, as well as aortic aneurysms. So pretty much the full spectrum of vascular disease is what we treat and manage. Today, I'm going to go over and present to you guys a case of peripheral arterial disease, and this is what's called an angiogram, where we perform a minimally invasive technique just through a needle puncture in the skin, outpatient procedure, which allows us to see the blockages in the arteries, and then right then and there treat the blockages in the arteries to restore blood flow. Our patient today is a male in his 80s who has diabetes and peripheral arterial disease, which commonly happens in diabetics and actually tends to happen in the small vessels below the knee, what we call the tibial vessels. And it requires sort of advanced expertise and comfort with these small vessels in order to get them open, and that's one thing that we specialize in here at AMI Vascular Institute. And this patient in particular has a wound that is not healing on his distal shin and also on his foot, and so what we're going to be doing today is evaluating where that blockage is in the tibial vessels, and I will show you that, and then we're going to be going over how we treat it and showing the results of that. So this is our angiogram. This is below the knee on our patient, and we should have 3 tibial vessels, okay? And you see 3 arteries here. If you can see the dark area, that's the X-ray dye that's inside of the artery, showing us the 3 arteries. And if you can appreciate this, on the far left we have a blockage in this anterior tibial artery, which is this one on the far left. You can see that the black X-ray dye starts to taper down into a thread and then disappears, and that's the blockage in the anterior tibial artery. And you can also see in the other 2 there are also multiple areas of stenosis or narrowing in the arteries due to plaque. Can you go to the next one? So this is in the high calf, so I'm going to show you a picture down towards the foot where we have issues with the non-healing ulcer. This again is the black X-ray dye that you'll see coming down. This is a side view of the foot, and you can see that by the time you get to the foot, there's really only one of these arteries that's open. That artery all the way to the left has sort of tapered out into nothing, so that's a 100% blockage for a long area. And you can see that the artery in the foot, what we call that reconstitutes, so the artery is open again at the top of the foot. That's that far left line that you can see there on the top of the foot. But the only artery that's getting out of the foot is the posterior tibial artery, and if you could appreciate towards the top of the screen here, we have either a short occlusion or at least a 90% narrowing in that artery as well. So I'm going to work on opening this, and we'll check back in a few minutes, and we'll go over some of the techniques we use to open this and hopefully achieve a nice result. So this is us navigating that blockage that we had just shown you before. So what we need to do in order to open this is to navigate across the blockage with a very small wire. And if you can appreciate on the screen, I'm manipulating this wire. The white area now is where the vessel is, and you can see my wire crossing very carefully across this small vessel blockage, and you see the wire is now beyond it. And now that we have a wire through the blockage, this gives us a variety of different options that we can use to help treat the blockage. Look at our picture, you can see that the wire's through the blockage. We've navigated through that, and we have this little dot that's up top above the blockage on the screen. This is what's called an atherectomy device, which literally means removing plaque. So the plaque that's built up in the artery, this device is going to grind it down and help remove it from the artery. And following that, we'll perform what's called an angioplasty, which will open up that blockage once we've removed the plaque and help restore the blood flow. So that's what we're going to do right now, and you'll hear some noise as the device does its job to clean out the artery. And what I'm doing is I'm steering this very carefully and slowly through the blockage and into the other side of it. And you can see this moving. Let me take our time with it and let it do its work. Now we're going to remove this, and we're going to follow this with an angioplasty balloon, which is a balloon to open the blockage. So we'll check in just a minute. So this is what we call an angioplasty balloon, and you're going to see, if you look at our screen here, you're going to see the balloon start to inflate in the background. If you see the dark area behind it, and I'm going to remove this white background picture, and you'll see the balloon. And can you see the little narrowing in the balloon on the waist? That's where it's narrowed, and there's plaque. And as we inflate the balloon, you're going to see the waist go away. Just like that. We let that sit for a minute to do its work, and that's going to help open up those blockages now that we've cleaned out the plaque. So I'm going to let this sit for a minute, and then we'll check right back in, and then we're going to show you the result. Okay, so now we've performed the atherectomy as we spoke about, and the angioplasty, and we took another x-ray picture, another angiogram after the treatment, and you can see now that that artery that we've treated, nice straight line flow, and if you can appreciate it or you want to look back, you can see that that previous blockage and narrowing where there was not black x-ray dye showing is now open and flowing intact down the foot. So this is a major change to blood flow to the foot and to the calf, and now we still have that other blockage in the front of the leg that we're going to continue to work and open as well. But we've already made a significant improvement with this one artery alone to the flow to his foot. So we'll check back in after that. Okay, so now we've done a little bit of work crossing this large blockage in that artery to the left of the screen, and we've just crossed the long occlusion. And if you can appreciate this, my wire is towards the top of the foot here. That's through the blockage. And the wire is in what we call the plantar arch. If you can see here, that's around the top area of the foot and in the arteries that supply the toes. These are the smallest and most delicate arteries that you can deal with through angiography, but that's what's required to open this to give him the blood flow he needs to heal his wounds. So what we're going to do is the same thing. I'm going to, off camera, we'll do atherectomy and then angioplasty, and we'll check in with the result. Okay, so we just finished performing atherectomy and angioplasty of the anterior tibial artery, which is that artery on the left side of the screen that was blocked. So this is just a reminder. This picture here is to remind you of what we began with. And you can see here, we started with just this one single artery that comes down to the foot on the right side of the screen with a blockage there in the top portion of it. And as I had indicated before, we should have another black line, straight black line on the left side of the screen going to the top of the foot. That's that pulse that you can feel on the top of your foot, and that was completely blocked. So this is what we started with, and now this is just a reminder. I'm going to show you what we have now after the treatment. So this is our final result here, and you can see that we've treated that top blockage, as well as you see now on the left side of the screen we have a nice straight line, inline flow. That's what we're looking for. So that artery now is completely open and flowing down the shin and into the foot. And this is going to help this patient heal his wounds, as well as relieve some pain that he's been having in there as well. This was all done in about the span of about an hour. He slept through the procedure with very, very minimal medicines necessary. It's not painful whatsoever, and it's just through a needle stick. So what we'll do is we'll finish up, and he will go home with a Band-Aid in a few hours. So that's kind of the advanced work that we're able to do nowadays with advanced peripheral vascular disease, and he'll go home, and really after 48 hours he really has no restrictions on what he can do, and we'll see him back in a few weeks. So thank you, and I hope this was informative for you all.